Hi, this is Dr. Monica Cisneros. Please watch this powerful interview and testimony of how the functional medicine approach allowed this patient to reverse her health conditions like rheumatoid arthritis, hepatitis, which is caused by a virus, leaky gut, allergies. Please watch. She is negative for RA because we were able to find the underlying causes. Stay tuned. When this patient showed up in my office in 2017, all I knew that she has so many problems. She had no lab testing and she had no answers. So I had to take this comprehensive investigation to get to the bottom of the problems. And indeed, I did find that she had been infected with the hepatitis virus, that she had rheumatoid arthritis, food allergies, severe nutritional deficiencies. What I knew for sure was that her immune system was not balanced and it was overreacting to the point of attacking her own joints. So we needed to get the immune system to work for us because obviously her immune system had not been efficient at fighting and preventing the hepatitis virus to infiltrate her liver. And it was too busy fighting her own joints. So we needed to identify the underlying causes of all this, the food allergies, seal the gut, and turn off all that inflammation. And most important, optimize her immune system. Let's watch. I'm going to use this picture to explain leaky gut. On the bottom, you have a blood vessel. On the top, you have cells, which are the barriers. Between the cells, you have openings where nutrition goes into the blood and is delivered to all the body and is stored inside cells. Those openings are held by special bonds. You can call it glue. But on the right side, those cells have been affected. Therefore, the openings are big and pathogens, viruses, foods enter the bloodstream and create an inflammatory response and can lead to autoimmune disease like rheumatoid arthritis. The way rheumatoid arthritis is treated is with medications to turn off the immune system. We were able to reverse this illness without medications. Instead, allowed the body to heal and give nutritional and lifestyle changes. The reason this patient was infected with the hepatitis virus was because pathogens, viruses, go into the bloodstream when our defenses, our barriers are broken. Please watch this powerful testimony of how functional medicine changed this patient's life. And I want to take this opportunity to educate patients of the importance of health exams and using the functional medicine approach to look into health. What symptoms brought the patient to my office? What was the medical problem?
So I started to have a face rash on only my right side of my face. And I tried everything, a dermatologist, I tried going to different doctors. They never figured out what it was. They thought it was just a skin condition, rosacea or dermatitis. Then I finally heard about Monica Cisneros, and she took care of me really good. She did a blood test and she found out that I had an autoimmune disease. So we had to take the necessary steps so she would use my immune system to fight, because she told me if I went to other specialists that they would put me on steroids and medications that would make me feel better, but in the long term it would affect my health a lot. So I started to do exactly how she told me to do, taking care of my diet, listening to stay away from all of my allergies. And after about a year and a half, I was able to get my immune system up and I was able to feel better and healthier. And yeah.
So I know that looking at your labs, we can see that in 2017 you had the rheumatoid arthritis factor positive, correct?
Correct.
What were your symptoms back then?
So back then, I was very, very exhausted. Anything, a small task would make me feel very exhausted. My bones, my joints would hurt a lot, especially from my legs. I couldn't keep up for a young person. I mean, the inside of me was dying, basically. So I remember throwing up at one point. I had my skin allergy. It would itch so bad. I felt like I had a face mask all day. My face was dry. I didn't have an appetite. My body was just trying to tell me that something was going on. So I was bad. I was tired.
And you also developed back then hepatitis, correct?
Correct, I did.
And it went unnoticed by your medical primary care doctors, correct?
Yes. Yeah.
So when I saw Jocelyn, her liver enzymes were up the roof, and her immune response was over exaggerated. She had anemia and she had all these deficiencies. But what were the doctors doing back then?
Nothing.
Nothing. Okay.
They did nothing. They didn't even take a blood test. They just would look at my face and say, "Oh, you have dermatitis," or they would think that I was anorexic because I didn't want to eat. But they didn't know that it was because I had the hepatitis. My body, it would just hurt. My stomach would hurt eating anything. So they just assumed from what I was telling them what I had. They never did a blood test. They never deepened any blood test at all.
Yeah, so that comes to show the importance, because hepatitis is still a virus. So obviously Jocelyn came this year because obviously she's concerned for COVID-19. She works in a bank where she has exposure to customers, and she wanted to optimize her. Our health depends on a strong immune system and on strong barriers. It doesn't matter if it's hepatitis virus, if it's influenza virus, if it is COVID-19. It doesn't matter. If your immune system is not strong enough, it cannot resist the fight. And when I saw Jocelyn back in 2017, she was very, very weak. I mean, she has changed to be somebody that was really ill to be a normal functioning adult. Her skin has changed, her everything has changed. And I think the reason why I want to do this video is to help patients understand that the medical route is amazing, it's great, but we doctors have to do due diligence. We cannot just tell patients, this is like a skin disease and not look for underlying reasons. Yes, she had a skin condition, that is correct, but what was causing the skin condition was this overload of allergens, and the liver was malfunctioning, and she had her immune system was attacking her joints. That's a body part that her body decided to attack. And how are your joint pains now, and your aches and pains? How are they now?
A lot of the times during the winter, my joints would hurt so much to the point where I was even scared to walk sometimes without not feeling pain. But this winter and the last winter, I mean, my bones don't hurt at all. They don't hurt at all.
What changes have you noticed on your labs because you have done like a health exam every year with me? What are the changes that you can see in your lab results?
So definitely my protein went up a lot. My vitamins, I used to take about 20 vitamins a day, and now I only take 6. So I was able to boost up a lot of the vitamins that I needed. My allergies went down. I was able.
What were the improvements after treatment?
My vitamins, I used to take about 20 vitamins a day, and now I only take 6. So I was able to boost up a lot of the vitamins that I needed. My allergies went down. I was able to have a more clear face. I mean, everything. My hepatitis was gone.
Yeah. And the liver came back normal.
Yes.
And that's I mean, obviously the medical route is great. And I give credit to all the doctors that are out there in the healthcare front lines. But we just have to take this approach to just listen to our patients and keep looking. Because otherwise patients start losing hope on the system, and patients start getting lost in the cracks of our system. And I think that I just feel that this is something important for us to realize. So making lifestyle changes is not easy, but it pays off. Tell me.
Everything has wheat, even chocolate has wheat. So it's been a little difficult. I remember going to the store and looking at all the food labels and spending hours trying to avoid everything that I couldn't eat. But it paid off. It really did.
Low cholesterol can lead to depression and anxiety. Underlying depression and anxiety, and it was because she had low cholesterol. In order for me to give a patient a roadmap, I need to have an overview of the immune response. Her immune response was down here, okay? Optimally, we would want the immune response to be here. This year, we have not done the micronutrient testing because she's under control, and right now she has deficiencies, so I want to fix that before I do this test again. Vitamin deficiencies also cause symptoms. As you can see, we had an issue with copper, serine, vitamin D, vitamin E, potassium. So her bones integrity was being compromised. Healing requires teamwork, but it works. Advices you have for people?
Yes, I would definitely recommend Monica because she takes really good care of her patients. Her consultations are not 10 minutes. She really wants to get to the bottom of how you're feeling. She'll ask you so many questions because she really does care about her patients and wants to make sure that everybody lives a happy and long lifestyle.
And also she has access to me 24/7.
I do, and I'm super grateful for that. I don't have to wait for someone to answer the phone and say, oh, she's out of the office. She always answers me, and she's always, able to answer my questions at 24/7.
And sometimes it can be a question of, hey, can I take this protein? Can I take this food? Is there a supplement, like a substitute? So we have to be there for our patients. If they trust us, we just have to be there for them. And I know that sometimes it can be in the middle of other patients, but I think the importance is to not neglect our patients and understand that they are part of our families. And to me, they are family. And I know that it's going to be a long road with this COVID-19, but I think that if we take Jocelyn as an inspiration of how the immune system can be optimized, I think we all are going to relax in feeling that there's ways we can feel safer. And I'm pretty sure Jocelyn can go back to work and say, you know what, I'm doing my due diligence. I cannot prevent that the virus is out there, but I know that I'm doing what I can to feel safer. Correct, Jocelyn?
Correct.
Yeah. Any last words for patients?
Stay healthy.
Yeah, stay healthy, definitely. Thank you so much, Jocelyn.
Thank you.
Here we're discussing the patient's lab results and setting up the treatment plan. See here, sugar is good, kidneys are good, liver is optimal, not abnormal at all. Your vitamin B12 in the blood is good, folate, excellent. The C-reactive protein is low. So obviously we're looking for 3 factors that put you in a high risk for COVID-19. You're negative, so that is great. Cholesterol, we had very low cholesterol in the past, and look at this, beautiful, normal, that's beautiful. Nice. So that's great news, okay? The iron is a little bit off, so that's why I'll give you iron supplementation to try to get this number up, okay? And we want to do that because we want the ferritin to go higher. Okay, we want this to be closer to 307, but we'll get there, okay? So in 2 months we will see a big difference.
I've been eating a lot of tuna and broccoli.
Good. Your thyroid completely normal. There's no infection except the allergies are kind of on, so we need to take care of that, okay? Your urine, the protein, I'll retest it right now. But everything else looks beautiful. Rheumatoid factor, negative. Sat rate, negative. ANA, which are inflammatory markers, negative. Okay, so that's great. As far as the food allergies, we have egg white, wheat, peanut, shrimp. Before we were having corn, egg, milk, peanut, soybean, walnut, wheat. So a lot of things disappear, but one appear, which is a shrimp. Okay, so but this was a very leaky gut. Now we still have that a little bit there. So now we want to make sure that we close that up, that you avoid this altogether, so it kind of seals again, because we know the dramatic improvement. That is great. Okay, so we'll fix that. And then the soybean is here again. The immunoglobulin is 590, so that's your allergic level. It shouldn't be higher than 99, so we really need to kind of lower that up. Let me see, what was it before? I have it here. It's in here. But it's pretty high, okay? And the vitamin D is, what is the vitamin D is 37, so we want an 80, okay?
Was this the immunoglobulin? It was,
Yeah.
So it's higher now than it was before?
Yeah. Because right now you relax a little bit, so right now we just, because this is when we did the intervention.
Mm-hmm.
Here is, we kind of relaxed the past couple months, and we just want to say, you know what, let me go back.
Okay.
Let me not play with my system because I don't want to go back to my RA being positive. Okay, so we want to do that, okay?
Okay.
So the treatment that I'll give you, and I wrote it down on the piece of paper here, is going to be hemogenics, which is the iron. We're going to optimally go to 2 capsules, but 1 is enough, okay? So we'll do that. Trigonomics is your multivitamin, okay? Once daily, and I wrote it down here for you, okay?
Oh, okay,
So 1 daily, your vitamin D, okay? And in the morning, as soon as you wake up, you're gonna do the glutamine, which is a glue to your cells, to try to fix that leaky gut again.
I love that supplement.
You good?
I do. It works so good on my stomach, and it does. It's good for my digestive system too.
Yeah. So 1 scoop in the morning with 1 vitamin C. This is just to optimize your immune system and also fix the leaky gut. And in 2 months, we'll repeat. You'll run out of the multivitamin, vitamin D, and we'll know where you are.
Okay.
But just kind of eliminate the things that are causing you allergies, okay? Do you have any questions for me?
Yes.
Go ahead.
When do I take the
Empty stomach.
Okay, so I can take that in the morning, right?
Yes.
1 supplement?
Yes. So remember, no dairy, but you're not doing dairy, which is great.
No. Okay, and then this is the multivitamin.
Yeah, so the multivitamin, vitamin D, you can take it together.
Okay, and that's like on an empty stomach or full stomach?
Empty stomach.
Okay.
No, I'm sorry, full stomach with foods, yeah.
Okay.
So everything with foods except whatever you do in the morning.
Okay, and then this together
As soon as you wake up, yeah.
Okay. How much of so 1 scoop of that, and how much of the
1. So 1 capsule, yeah.
Oh, 1 okay. Is that also powder?
No, that's yeah.
A capsule.
Yeah,
Okay.
but it's gonna help your collagen, so it's gonna help a lot of the skin and all that. But we want to obviously boost your immune system in case you go back to work, to be.
Okay.
And then in 2 months we'll be able to do that. Okay.
Okay.
So these are your lab results. You can take that.
Okay.
Okay. And maybe in 2 months we might repeat the nutrient testing just to see where your immune system is. But right now everything seems under control.
Okay. Sounds good. Also, I have a quick question. For the protein, is there a protein that I can have that's plant-based and doesn't have soy? Or?
I ordered you some, but it was on back order.
Oh, okay.
So as soon as I have it, I'll text you to see if you want to come and pick it up. Okay. And it's by far the best because he has prebiotics, so it's going to help the GI, okay?
Perfect. Also, I've been eating healthy. I've been avoiding the foods that I am allergic to, but I've noticed that I still sometimes get an allergy, and I don't know if it's because my body's getting rid of the leftover bad food that I was eating before I started eating healthy, or if it's still like, I don't know.
Are you is it something visibly that you see?
Yeah, so I'll see it sometimes here and here, and I don't know what it is.
Yeah, so I know that you see the labs, it's 509, and the eosinophils are very elevated. So that means that you are actively fighting foods that you're eating wrong. Okay. Let that clear up, take this. If that doesn't clear up like in 2 weeks, give me a message and I might give you something to kind of clean your body. Okay. But for right now, you're doing so great. Make sure that you eat a lot of greens, and that's going to bind all that toxin that has accumulated. But no, that should be fine. Okay. Okay.
Also, is the cleanser that, I don't know if you were able to see the one that I sent you. I remember you recommended it to me when I
That's
first.
beautiful.
So that one's good to use.
Yeah.
Okay.
Yeah. And plus, it has hyaluronic acid, so that's going to help replenish the coating on the skin.
Okay. And then I still use coconut oil as a moisturizer, right?
Yes.
You told me. Okay.
Yeah. That's by far the safest. And if it's not bothering you, just continue it.
Okay. I have noticed that I'm getting like a little bit of blackheads on the nose. I don't know if it's because I'm putting maybe too much on my nose.
Yeah, so my advice is do the coconut oil with baking soda. So kind of use it as an exfoliant. Put the coconut oil and then do the baking soda and rub it, so it kind of gets rid of the dead skin. You're gonna feel your skin is so beautiful.
Okay.
Yeah, so do that.
Okay, perfect. Also, I remember you told me that the reason why I may have dark circles is because of allergies, right?
Allergies and also the anemia. So that's kind of so kind of monitor that. We should see a dramatic increase now that we are gonna start taking the vitamins.
Okay.
So keep an eye.
Okay.
That's mostly is the allergy just because it's active, but also the low iron.
Okay.
Okay.
Perfect. And then is this my receipt?
Yeah, this is your receipt.
Okay, perfect.
And I can send you the invoice through PayPal.
Okay.
And we can do that through PayPal with the credit card. Okay, but I'll just give it to you right now.
Okay.
And make sure you take your lab results. Okay.
Okay.
And overall, you're doing well, right?
Yes.
And your mom is letting you be independent.
Yeah. Yes. Yes, it is.
Yeah, but your mom is amazing. Honestly.
Yeah. Thank you so much.
Yeah. So remember, 2 months. I want to see you back.
Okay.
Text me in 3 days to give you the urine results. I want to see if the protein's still high. But if you're drinking more water, right?
Yes, I am
Beautiful.
drinking more water.
Yeah. So that should solve that.
Okay.
Okay. Awesome, Jasmine. Thanks so
Thank
much
you
for
so
coming.
much.
Okay?
Thank you.
And see you.
This is Dr. Monica Cisneros, Doctor of Chiropractic and Functional Medicine Specialist.